Good afternoon. It's great to be with you all today. Thank you, Steve, for acknowledging Sister Andrea and the extraordinary impact she's had on Peace Health and so many of us gathered here today. Let me add my own personal congratulations to Sister Andrea on her momentous 60th Jubilee and all that she has accomplished. Sister Andrea, you truly embody the legacy and the spirit of the founding sisters, offering healing, compassion, wisdom, and joy to me and to countless others. Thank you. In times like these, it's simply wonderful to have a person like Sister Andrea to celebrate. We are so thankful and blessed to have you as part of our Peace Health family. As Steve shared, Sister Andrea is beloved for many things, including her great sayings, or as we call them, Sister Andreisms. Today, one in particular comes to mind. Not too long ago, Sister Andrea spoke to Peace Health's burning ball of accountability, how we have this unwavering responsibility to protect and propel our mission and our legacy by relentlessly caring for all. And more often than not, this burning ball of accountability means we have to make tough decisions, decisions that may not always be popular with all, but stay true to our mission and our values. Sister Andrea and the Sisters of St. Joseph of Peace model the courage, discipline, and servant leadership required to make hard decisions in service to the common good. Today, as we face the fifth wave of COVID-19, we draw on their strengths and their example as we relentlessly and courageously care for our patients, caregivers, and our communities. As you know, Peace Health took a bold step earlier this month when we announced our COVID vaccine requirement. We did this before other health systems and before state governments announced their mandates. Upon completion of our ethical discernment, it became clear our mission, vision, and values called us to act. I feel strongly that it was the right decision, and I am proud that Peace Health was at the forefront. I commit to you that we will continue to do everything within our power to keep our patients, caregivers, and the community safe, and always live up to our mission. This is our burning ball of accountability. Despite the disapproval of some, but thanks to your hard work to inform and support and encourage your unvaccinated folks on your teams, I am heartened by the response of our caregivers. As of this morning, 1,600 caregivers have updated their vaccination status, putting us at 87% across the system. This is a great step in the right direction. Unfortunately, the latest data indicates we must do more. In the last week, after considerable deliberation, we have decided to further strengthen our stance. After October 15th, all patient care at Peace Health will be delivered from vaccinated caregivers. For many of you, I know this new requirement puts additional stress on your teams. And in some cases, we're losing talented caregivers. But the fact is, the transmission risk from the unvaccinated is simply too great. Since August 3rd, the public health emergency has even become more acute. Peace Health has set multiple records for COVID-19 inpatient admissions, exceeding the peaks of this past January. And you'll hear from Richard and Doctors Cook and Pels. Sadly, the Delta variant continues to drive up our volumes. Each day is a new record high. It's a similar picture across all of our communities and sadly, across the entire country. And the latest modeling doesn't show things letting up for several more weeks. While the fifth wave is challenging on our resources and our people, as Richard will share, We have a solid foundation in place, and we are operationally ready. I know it's been an extraordinarily challenging time, one that's demanded so much of you as leaders and your teams, time and time again. But we've got this. I have no doubt our team, all of us here today, will rise to the occasion yet again, as we've done throughout the past 17 months. I have full confidence we'll continue our stellar work in service to the common good in our mission, just as the founding sisters would. We stand on their shoulders. We find strength in their strength. As we find ourselves deep in the trenches yet again, I will ask for your help in continuing to support our extraordinary caregivers and one another. Our caregivers are exhausted, yet dedicated heroes, and they deserve our praise and appreciation. So please keep it up. Please continue to support your team and them, and embrace a pro-vaccine culture. Viruses like COVID-19 are here to stay. If we are to preserve personal and community health, vaccines are undoubtedly our best protection. And you need to continue to be vital ambassadors. Before I finish, I wanted to take a moment to express my gratitude. I feel blessed every day to work with such an immensely talented group of people. This leadership team, each of you are exceptional. We're in this position of strength because of you. You are Peace Health. I want to leave you with inspiring words from Dr. Rick Padgett, System Medical Director of the Cardiovascular Services in Oregon. The reflection he shared with his fellow colleagues rings true for me when thinking of this team and our 16,000 amazing caregivers. Dr. Padgett wrote, "When I see you comforting a scared patient, I am proud. When I hear you talking to a confused patient on the phone, I am proud. When I see you all going about your job with a steely-eyed determination, but still a smile on your face, I am proud. I'm proud of you, but mostly I'm proud to work with you." And he ends with, "We will get through this challenge, as we always do, together."